1. What is medical coding? Medical coding is the transformation of healthcare diagnosis, procedures, medical services and equipment into universal medical alphanumeric codes. XDTL ICD, CPT, HCPCS. 2. How do you know about medical coding? I was searching on internet career opportunities after graduation. I found medical coding is fast-growing and suitable for me. 3. What types of specialty in medical coding do you know? EM, ED radiology, denials, pathology, surgery, etc. 4. Do you have knowledge in anatomy and physiology? Anatomy is about body structure like bones and organs. Physiology is about how those organs work together. 5. Circulatory system. The circulatory system is the body's system that circulates blood, oxygen, and nutrients to all parts and removes waste products. The system has 3 main components: the heart, blood vessels, and blood. The heart acts like a pump, pushing blood throughout the body. It has 4 chambers, 2 atria, and 2 ventricles. Blood vessels include arteries, veins, and capillaries. Arteries carry oxygen-rich blood from the heart. Veins bring oxygen-poor blood back to the heart, and capillaries deliver oxygen to cells. Blood contains red blood cells for oxygen transport, white blood cells for fighting infections, and platelets for clotting. ICD-10-CM, I-10, hypertension, I-50, heart failure. CPT-93458, cardiac catheterization. 6. What are the parts of digestive system? The hollow organs that make up the GI tract are the mouth, esophagus, stomach, small intestine, large intestine, and anus. The liver, pancreas, and gallbladder are the solid organs of the digestive system. 7. How many bones are present in human body? There are typically around 270 bones in human infants, which fuse to become 206 bones in the human adult. 8. Skeletal system divided into how many parts and what are that? These bones can be grouped in 2 divisions: axial skeleton and appendicular skeleton. 9. The type of bones which are present in human body. Types of bones in human body: long bones, short bones, flat bones, irregular bones, sesamoid bones. Digram se naam yaad karein. Thus, what is BP and normal range? Blood pressure is a measure of the force that your heart uses to pump blood around your body. Ideal blood pressure is considered to be between 120s-80 mmHg. What is mean by diastolic and systolic? Diastole is when the heart muscle relaxes. Systole is when the heart muscle contracts. 12. How many chambers in human heart and enlist? Total 4 chambers. Right atrium, right ventricle, left atrium, left ventricle. 13 layers of the heart wall. 3 layers. Epicardium, myocardium, endocardium, 14 roll of artery and vein. Arteries carry blood away from your heart. Veins carry blood back toward your heart. 15. Explain respiratory system. When we breathe in, air enters our respiratory system through our nose and mouth. As the air passes through these, it is warmed and moistened before it travels towards the lungs through a tube called the trachea, which is supported by rings of cartilage. The trachea leads to 2 larger tubes called bronchi, which branch into smaller tubes called bronchioles. At the end of each bronchiole, tiny air sacs called alveoli are present. Oxygen and carbon dioxide are exchanged at these alveoli through their thin walls and capillaries. Oxygen is picked up by the blood and delivered to the body cells. At the same time, carbon dioxide, a waste gas, moves from the blood into the lungs and is exhaled. 16. Which is the longest and smallest bone in human body? Longest, femur, strongest, smallest, stapes. 17. What are ICD-10, CPT, HCPCS codes? CPT, current procedural terminology. Codes represent medical procedures. ICD-10, International Classification of Diseases. Codes represent diagnoses. HCPCS, Healthcare Common Procedure. Coding system. Codes are used for medical supplies and services. 18. How many body systems are present in human body? 11. 1. Circulatory system. Major structures: heart, blood vessels, blood, cardiovascular, lymph nodes and vessels, lymph, lymphatic. Functions: transports nutrients, wastes, hormones, and gases. Digestive system. Major structures: mouth, throat, esophagus, stomach, liver, pancreas, small and large intestines. Functions: extracts and absorbs nutrients from food, removes wastes, maintains water and chemical balances. 3. Endocrine system. Major structures: hypothalamus, pituitary, pancreas, and many other endocrine glands. Functions: regulates body temperature, metabolism, development, and reproduction. Maintains homeostasis. Regulates other organ systems. 4. Excretory system. Major structures: kidneys, urinary bladder, ureters, urethra, skin, lungs. Functions: removes wastes from blood, regulates concentration of body fluids. 5. Immune system. Major structures: white blood cells, lymph nodes and vessels. Skin functions: defends against pathogens and disease. 6. Integumentary system. Major structures: skin, nails, hair. Functions: protects against injury, infection, and fluid loss. Helps regulate body temperature. 7. Muscular system. Major structures: skeletal, smooth, and cardiac muscle tissues. Functions: moves limbs and trunk, moves substances through body, provides structure and support. 8. Nervous system. Major structures: brain, spinal cord, nerves, sense organs. Functions: regulates behavior, maintains homeostasis, regulates other organ systems, controls sensory and motor functions. 9. Reproductive system. Major structures: testes, penis, in males, ovaries, uterus, breasts, in females. Functions: produces gametes and offspring. 10. Respiratory system. Major structures: lungs, nose, mouth, trachea. Functions: takes in oxygen and expels carbon dioxide through the lungs and alveoli. 11. Skeletal system. Major structures: bones and joints. Functions: protects and supports the body and organs. Interacts with skeletal muscles, produces red blood cells, white blood cells, and platelets. 19. Common medical terminology and surgical terms. Here are common surgical suffixes, their meanings and examples. Centesis: puncture a cavity to remove fluid, e.g. amniocentesis. Ectomy: surgical removal, excision, e.g. appendectomy. Ostomy: a new permanent opening, e.g. colostomy. Otomy: cutting into incision, e.g. tracheotomy. Oriphy: surgical repair or suture, e.g. herniorrhaphy. Opexy: surgical fixation, e.g. nephropexy. Oplody: surgical repair, e.g. rhinoplasty. Otripsy: crushing or destroying, e.g. lithotripsy. Same list exactly as apne likha tha. Surgical suffixes and diagnostic suffixes. 20. What is your strength? I am a quick learner and a great team player. 21. What is your weakness? I can concentrate on one thing at a time. 22. Why do you need a job? From now onwards, I want to take my responsibilities and to show my skills and knowledge and talent. 23. What is revenue cycle management? Revenue cycle management, RCM, is the process healthcare organizations use to manage financial operations related to billing and collecting revenue for medical services. 24. What is HIPAA? HCPC-A, Health Insurance Portability and Accountability Act, is a set of regulations that protect patients' sensitive health information, including in medical coding. 25. Which vein that carries oxygenated blood in the human body? Pulmonary veins. 26, which is the smallest organ in the human body? Pineal gland, or he 8 mm size. 27. How many types of muscles on there in human body? 1. Skeletal muscles. 2. Cardiac muscles. 3. Smooth muscles. 28. Which valve is present between the left atrium and the left ventricle? Mitral valve, Ishi, bicuspid valve. 29. Which is the master gland in the human body? Pituitary, master gland. 30. How many lobes are found in human lung? The right lung has 3 lobes, the left lung has 2 lobes. 31. What are the 3 parts of pharynx? Nasopharynx, oropharynx, laryngopharynx. 32 layers of epidermis. Stratum basal, stratum spinosum, stratum granulosum, stratum lucidum, in thick skin only, and the stratum corneum. 33. What are the skills that a medical coder should possess? A medical coder should know CPT, ICD-10, and HCPCS codes, have good knowledge of medical terms and anatomy, be detail-oriented, follow HIPAA rules, and be comfortable using computer systems or EHRs. 34. What are the common phrases used in clinical coding? Common phrases include terms like rule out, confirmed diagnosis, post-operative, pre-existing condition, follow-up, encounter for, history of, and signs and symptoms. 35. What are the HCPCS? Healthcare Common Procedure. Coding System. 36. What is DRG? DRG stands for Diagnosis-Related Group. It's a system used to classify hospital cases into groups. 37. How is medical coding used in the practical world? Medical coding is used to convert patient records into standardized codes for billing, insurance claims, and data analysis. 38. What is the difference between ICD and CPT coding? ICD codes are used to describe diagnoses, what's wrong with the patient, while CPT codes are used to describe procedures and services, what the doctor did. 39. What is a J code in medical billing? J codes are part of HCPCS Level 2 and are used to bill for drugs, medications, and injectable substances. 40. What is ICD-10-CM? ICD-10-CM stands for International Classification of Diseases. 10th revision, clinical modification. 41. What are the types of medical billing coding system specific to healthcare? Diagnostic codes, pharmaceutical codes, topographical codes. 42. What is principal diagnosis? Principal diagnosis is the condition that is mainly responsible for the patient's admission to the hospital after study. 43. What are the 3 classification of wound repair? Simple, intermediate, complex. 44. Define write-off in medical billing. Write-off is the difference between total charge and the allowable amount by the insurance. 45. The primary abilities of a medical coder. A primary ability of a medical coder is analyzing medical documentation to assign standardized codes for diagnoses, procedures, and services. 46. What is the difference between inpatient and outpatient coding? Inpatient coding is used for hospital admissions, while outpatient coding is used for procedures and treatments where patients are not admitted. 47. How do modifiers work in CPT coding? Modifiers provide additional information about a procedure. 48. What is the purpose of ICD-10 codes? ICD-10 codes help track diseases and conditions, assist in healthcare research, and ensure accurate medical billing. 49. What is medical necessity in coding? Medical necessity means that a procedure or service must be justified based on the patient's condition to be covered by insurance. 50. What is the significance of HCPCS in medical coding? HCPCS, Health Insurance Portability and Accountability Act, protects patient health information and ensures secure medical billing practices. 51. How do you stay updated with changes in medical coding? I follow AAPC and AHIMA updates, take certification courses, and enroll in clinical research training programs. 52. What are the different planes of the human body? O. The sagittal plane divides the body into left and right halves. O. The frontal, coronal plane divides it into front and back. O. The transverse, horizontal plane divides it into top and bottom. 53. Which organ produces insulin? The pancreas produces insulin, which regulates blood sugar levels. 54. What is the function of the liver? The liver detoxifies chemicals, produces bile, and helps in metabolism. 55. Where is the pituitary gland located? The pituitary gland is located at the base of the brain and regulates hormones. 56. What is the difference between tendons and ligaments? Tendons connect muscles to bones, while ligaments connect bones to other bones. 57. What is the function of red blood cells? Red blood cells, RBCs, carry oxygen from the lungs to tissues and remove carbon dioxide. 58. How does blood flow through the heart? Blood enters the right atrium, moves to the right ventricle, travels to the lungs, returns to the left atrium, and is pumped out through the left ventricle. 59. What is the function of hemoglobin? Hemoglobin binds oxygen in red blood cells and transports it throughout the body. 60. What are the different types of white blood cells? Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. 61. What is the primary function of the kidneys? The kidneys filter waste, regulate electrolytes, and maintain blood pressure. 62. How does the nervous system transmit signals? Neurons send electrical and chemical signals through the synapses using neurotransmitters. 63. What are the different types of anemia? Iron deficiency anemia, sickle cell anemia, and pernicious anemia. 64. How is diabetes classified in ICD-10? E10 for type 1 diabetes, E11 for type 2 diabetes. 65. What is the difference between benign and malignant tumors? Benign tumors are non-cancerous, while malignant tumors are cancerous and can spread. 66. What is COPD? Chronic obstructive pulmonary disease, COPD, is a lung condition that makes breathing difficult. 67. What are the different types of fractures? Simple, compound, comminuted, green stick, and spiral fractures. 68. How is hypertension coded in ICD-10? I10 for primary hypertension, I15 for secondary hypertension. 69. What causes kidney failure? Diabetes, hypertension, and infections.